Good morning everyone. My name is Rathod Kaushalya. Our today's topic is epilepsy, hysteria and difference between the epilepsy and hysteria. Under the guidance of Dr. Manu sir, Professor and Head of Department of Psychiatry, my topic is hysteria. Hysteria, also known as the conversion disorder or psychoneurotic disorder, characterized by violence, emotional outbreak, disturbance of sensory and motor function. Etiology. First, psychological factors. Repressed emotion, desire for attention. Second, personality traits. Historical personality, immature, dependent and suggestible individual. Stressful conditions, relation issue, family conflicts and academic and work stress. Fourth is social factors. Low education, poor coping skills. Symptoms. Shortness of breath, anxiety, fainting, partial paralysis, hallucination, nervousness, insomnia, mutinism, irritability, and blindness. Related condition, illness, anxiety disorder, psychological factor are affecting other medical condition. Diagnosis, history note, organic and psychosocial factors, general examination, systemic examination, relevant investigation, diagnosis formulation, course and prognosis. Initial symptoms resolve within day to within a month. 90 to 100% are resolved. Predictor of good prognosis, sudden onset, early identification, good coping skill, short duration. Predictors of not good prognosis is aphonia, blindness, paralysis, and seizures. Treatment. First is psychotherapy, counseling, antidepressant, and antipsychotic drugs. Supportive and behavior therapy, home modification, and family education. Occupation and physical therapy, physical activity and exercise. Reassurance and rehabilitation. Thank you.
Start.
Good morning everyone, myself Biren Patel and I am going to explain about epilepsy. Epilepsy is also known as convulsions and seizures. Epilepsy is a chronic neurological disorder characterized by tendency to have recurrent unprovoked seizures. A seizure results from abnormal, excessive, synchronous electrical activity in the brain. Mainly there are two types of seizures, generalized and focal. In generalized seizures, tonic-clonic, absence, myoclonic and in focal seizures, simple focal, complex focal seizures are seen. Clinical features for epilepsy are loss of consciousness, convulsions, tongue bite, frothing, urinary incontinence, post-ictal confusion, headache and sleepiness. Aura may precede focal seizures. Diagnosis can be made by EEG of brain, MRI of brain and blood tests to rule out metabolic causes. Treatment for epilepsy is anti-epileptic drugs like sodium valproate, carbamazepine, levetiracetam and phenytoin. Surgery for drug-resistant epilepsy. Vagal nerve stimulation can be done. For precaution, we have epilepsy hygiene. Epilepsy hygiene refers to the daily lifestyle measures and precautions taken by a person with epilepsy to reduce seizure frequencies, prevent triggers and ensure safety of the patient. Medication compliance is the first part. Take anti-epileptic drugs regularly and at the time same daily. Do not stop medications abruptly. Sleep and rest. Maintain regular sleep pattern for 6 to 8 hours. Avoid sleep deprivation as it increases the seizure chances. Stress management. Avoid emotional stress, anxiety and extreme excitement. Use relaxation techniques like meditation and yoga. Avoid seizure triggers like flashing lights, alcohol, nicotine and recreational drugs. Sudden and loud noises and skipping meals. Diet and hydration. Balanced diet rich in fruits, vegetables, whole grains and adequate hydration. Physical activity and safety. Normal activities are allowed but avoid high risk activities like swimming alone, climbing heights and operating heavy machinery. Use a shower instead of bathtub to avoid drowning risks. Avoid dangerous environments. Avoid cooking on an open flame without assistance. Use microwave instead of gas stove if possible. Seizure first aid knowledge. Family and friends should know about that. Place and patient on the left side to prevent choking. Do not put anything in the mouth. Cushion the head and loosen the tight clothing. Seek medical help if the seizure lasts for more than 5 minutes. Regular medical follow-up should be done. Thank you.
Start.
Good morning everyone. Now I am explaining the difference between conversion and convulsion disorder. The conversion disorder is also known as hysteria and the convulsion disorder is also known as epilepsy. The hysteria is a neurological or psychological disorder while epilepsy is a neurological disorder. The main cause of hysteria is psychological stress while the cause for epilepsy is abnormal electrical activity in brain. In hysteria, it is a functional disorder while epilepsy is an organic disorder. The onset of hysteria is sudden, often after stress or trauma, while onset in epilepsy may be sudden, not necessary due to the stress. The consciousness is usually preserved in hysteria while the consciousness is lost or impaired in epilepsy. The movements while hysteria is wild, irregular, non-rhythmic and exaggerated, while and the movement in epilepsy is tonic-clonic and stereotyped. Injury during attack in hysteria is rare, while it is common in epilepsy. The main injury in epilepsy are like tongue bite and head injury. Urine or fecal incontinence is absent in hysteria, while it is common in epilepsy. Response to stimuli in hysteria may be respond to the pain or command, while there is no response to the stimuli in epilepsy. Post-ictal confusion is absent in hysteria and present in epilepsy. Duration of hysteria is often prolonged around 1 to 3 hours and duration in epilepsy is short term around 1 to 2 minutes. The EEG findings in hysteria is normal and EEG findings in epilepsy are abnormal during seizures or around the seizures. Suggestibility in conversion is present and absent in epilepsy. Secondary gain is often present in conversion and absent in epilepsy. The pupillary reflux and ankle reflux are absent in hysteria and present in epilepsy. Eye rolling is uncommon in conversion and upward rolling is common in epilepsy. The treatment mainly for hysteria is psychotherapy, reassurance and stress management, and treatment for epilepsy is anti-epileptic drugs. Conclusion. The aim of making this video is to differentiate between hysteria and epilepsy. Thanks to the Dr. Manu Parmar sir for giving us opportunity and constant guidance throughout the session. Now, Dr. Manu Parmar sir will explain why these two topics are important.
Thank you, Bhargav. Sometimes even senior doctors are making mistakes in difference between the hysteria and epilepsy due to improper history taking and diagnosis. By proper history taking and investigations, they can avoid unnecessary use of anti-epileptic drugs in the patients of the